Have you ever experienced a gradual change in your body? Maybe a weakness or an imbalance that slowly but steadily seems to worsen without any clear periods of improvement. Understanding why these changes happen is a crucial first step towards clarity and effective management. When it comes to a diagnosis of primary progressive multiple sclerosis, or PPMS, the defining characteristic is a steady worsening of neurological function from the very beginning, without early relapses or remissions. It is a slow, continuous accumulation of disability over at least 1 year, often marked by challenges with walking and balance. The why behind this diagnosis lies in how PPMS affects the central nervous system differently from other forms of MS. Instead of distinct attacks and recovery periods, PPMS involves a more constant neurodegeneration, where nerve damage gradually builds up. This progression means that symptoms do not come and go, but rather accumulate over time, leading to a slow and steady decline. The body's immune system directly attacks the nerve fibers and their protective myelin sheath, leading to irreversible damage that gradually impairs function. If you are noticing a gradual, steady decline in neurological function, especially with movement, it is important to communicate this clearly to your doctor. They will typically look for evidence of continuous progression for at least 1 year, assess your neurological examination for signs like increasing difficulty walking, and order imaging tests such as MRI scans of the brain and spinal cord. These scans help identify lesions, which are areas of damage consistent with MS, particularly those in the spinal cord that correlate with progressive motor symptoms. They might also perform a lumbar puncture to analyze your cerebrospinal fluid for specific MS markers. A key insider detail for PPMS is that spinal cord lesions are very commonly found and often correlate strongly with the progressive gait and balance issues that are hallmarks of the condition. Unlike other forms of MS, brain lesions in PPMS may be fewer or less dynamic. Additionally, the diagnosis often comes later in life, typically in a person's 50s, compared to relapsing remitting MS. This later onset, combined with the gradual nature of symptoms, can sometimes lead to diagnostic delays. Understanding the persistent and gradual nature of PPMS symptoms is essential because it guides the diagnostic process and helps you and your medical team identify the unique path this form of MS takes. Recognizing these subtle, continuous changes allows for earlier intervention and better planning for managing your health and maintaining your quality of life.